Today we're going to be talking about lumbar flexion, or the ability to bend forward in the curve of your spine as you go down. So if you are limited in that motion, if your back just feels stiff when you bend forward and things like that, this video is for you. We're just going to break down everything that can be involved and give you a couple exercises targeting each thing.
As always, if you're having pain doing any of these exercises or while you're trying to perform some of these motions, it might be more appropriate for you to seek a medical provider, whether that's a physical therapist, a physician, etc., especially if you have some extenuating medical history. Not the most exciting thing to say, but is something that you should consider as well.
First, we're going to look at the quality of movement. So Steve here is going to go ahead and bend forward, and it might be good if you can have someone look at it or something like that. You're looking at how the curve down here compares to all the way up here. So with Steve, he is a little bit stiff through the lower lumbar, and the curve increases as we go through this area. So we would want to loosen this up here a little bit. So go and stand on back up. This can be related to joint, muscle. It can be a motor control thing, which is just like coordination and working on the patterning. And then it can also be neurodynamics. And as always, it sometimes can be just one of those things. Sometimes it can be a combination of some or all of them. So this is why someone who knows what they're looking at can be helpful in breaking it down for you too. So first we're going to talk about a joint mobility restriction. So you have muscles, you have joints. We're talking about the joint itself. Your spine is made up of a ton of small little bones, and you want them to distribute the curve evenly. So like as I was talking with Steve earlier, you want these to move evenly throughout. So you want a little bit more of an even curve here. If you're thinking that joint mobility might be playing a role, a couple of exercises to loosen things up. So a lot of times loosening up into rotation, because rotation is you're opening up one side and closing the other side. And so repeating that motion can be really helpful. So doing something like a figure 4 lower trunk rotation, this will help loosen up the hip as well, because sometimes that can contribute. So go ahead and cross your ankle over your knee, and you're just gonna rock your knees from side to side. So you're gonna feel a little bit of a stretch through the hip and through the back on this side. And you might feel a little bit stiff on the other side as well. And you might be able to go farther on one side versus the other, and that's completely okay and normal. So figure 4, rocking from one side, just the point of stiffness or tightness, and then rocking back the other direction. You just want to touch it and then come out of it. You don't need to crank on it because you don't want it to tighten back up if you are trying to push it a little bit farther than it should. Essentially, your body can sometimes kick on a protective response and tighten things up a little bit more if you're going a little bit too aggressively into it. Another thing is an open book. So laying on your side. Yep, and then you're gonna open. And then you're going to twist and look back. So essentially you can have both knees bent here, and that's a little bit easier for you as you look at your hand and twist open. Another thing to make it a little bit more aggressive of a stretch, you can have your bottom leg straight and your top leg bent and higher, and you want to keep this knee on the ground as you twist and open back. You can use a pillow underneath your head if you want to make it a little bit more comfortable for you, but you're getting a good stretch. Again, closing one side, opening the other, and you want to repeat this one on both sides too. The second thing can be more of a muscle limitation. So you have a ton of muscles running down the spine. So you have your spine, and then you have a ton of muscles running down either side. Sometimes they can span all the way across several segments. Sometimes they can be super tiny ones in between each segment. So depending on the muscle or muscles that are involved, it can go up higher. Typically, muscles do like a little bit of heat, so if you want to either do some exercises to get your heart rate up to just get some blood flow to that muscle, or you can lay on a heating pad while doing some of these exercises if you want as well. You can also use a hot shower or a sauna or just a general warm-up too to help get a little bit more blood flow to that area. We're gonna go over 2 stretches, or actually 3 stretches here. We're gonna start with a child's pose. So you can get on your hands and your knees, and then you're gonna rock your hips towards your heel just to get a little bit more stretch through that lower lumbar. You can think about tucking your tailbone under to get a little bit more of a stretch through that lower back, which is what we're trying to target here. You can rock back and forth, or you can hold this position a little bit longer, depending on what's comfortable for you. Another thing that you can do that'll simulate that is laying on your back and hugging your knees towards your chest. So coming here, you can do one at a time, or you can do both at the same time. If you do have any pinching in the front of the hips, just bring your knees apart a little bit. That can be due to some stiffness in the hip or just based on your anatomy. So whatever's comfortable for you there, you should feel a little bit of a stretch in the low back. And this is something that you can do like laying on a heating pad or something like that too. Another thing too that you can do is a stretch for the side of your trunk. So your quadratus lumborum or QL is on one side here, and that can sometimes limit. It typically is more so the side. And you can also get this for the side of the hip. So crossing with one leg behind the other and then leaning over. You can stand in a doorway and grab the doorway and kind of push away a little bit more if you want to get a little bit more of a stretch. So that'll loosen up the side of the trunk and also the hip a little bit, because sometimes fascially you have essentially like your whole entire fascial system. This can kind of dive down a little bit of a rabbit hole, but you have connective tissue going throughout your body. So the hip muscles have the same fascia that go up to the back and things like that. So the hips can also, if those are a little bit tight, that can affect the back. The last thing is a little bit of a straddle forward fold. So standing, and you can just kind of lean over and hang, and you can even just rock from side to side there. This will loosen up a little bit of the back of the legs and the low back, and you can use gravity a little bit more just to kind of sink into that.
So while the muscle stiffness is probably the thing that most people think about when they say that their back feels tight, especially when they're bending, the joint is another common one that some people kind of think about, or sometimes even blame arthritis on. But there's two other factors that typically the average person isn't really considering too much, and usually can play anywhere from a small to a very significant role in terms of your ability to bend forward. So the next one is motor control, which is really just your body's ability to use its muscles to control this motion. And especially with bending forwards, a lot of times it's either a core issue in terms of the abdominals in the front, or it's your body's comfort level with letting the back muscles lengthen as they're having some resistance or some load being placed through them. So we'll show you a few quick exercises to work on that. So the easiest one is getting on your back, typically with your knees bent, is going to be the most comfortable position, and it's what's called a pelvic tilt. It's very simple. Technically there's anterior or posterior, but the one that we'd want to do is typically posterior pelvic tilt that most people have the difficulty with, and that's just engaging the abdominals here. And it's almost like if you had a target on your low back that you're trying to push your belly button down that ways. What I'd say from this standpoint, for me very frequently, having a little bit of a target is what I call it. So just having something kind of at that like belt line, so to speak, for you to actually feel that you're pushing into. So sometimes even the clinic will use ice packs because the ice pack will absorb a little bit. So that works pretty well for some people.
A little towel would work.
Towel as well. So just something that can kind of absorb that, but not something that's too large that it kind of feels like it's kind of jutting a huge arch in your back. Once we are able to control that, we'll typically try to change positions. So a cat camel is another one that's very common.
All right, I'm going to redo this really fast because I was editing it and I realized the positioning of Steve behind me did not work out by any means. So cat camels is essentially doing that same motion, rounding out the back, kind of tilting the hips under, and then coming down and reversing it the other way. So you're getting some motion through the lower back and the mid back. You can even add the head going down and then coming up as well to get through the whole spine. Sometimes you might notice yourself moving a lot through the upper back and not a lot through the lower back. So you can shift forward, kind of biasing the upper back to work on that, or you can shift back to work the lower back, or you can also use a band, which we'll show in a second.
Sometimes having some video feedback of yourself doing it can actually be very helpful when you're on your own, usually from a side view like this. You can progress that a little bit using a little bit of a resistance band as well. So these are just monster bands, but I mean, you could use a TheraBand as well or something to that nature. And sometimes this isn't even always about the resistance itself. Sometimes it actually has more to do with just being a physical target, just like we were talking about with the ice pack, where it's like, hey, it's not even that this resistance is a lot, it's a very small band, but it's saying, hey, move here, and your body gets a little bit better feedback that specific segment's the one that's moving.
And you can move it up or down depending on where. So if I wanted to get a little bit more motion through here, I'm going to push up there, or you can go down below and do the same thing.
And that's where having that feedback of a video, you doing the cat camel typically is helpful because you can see where you're not moving it so well, and then you can put the band, place the band accordingly. So a more advanced progression to build your body's comfort level with lengthening the back muscles under resistance called the Jefferson curl. Main things that I'd say with this before going out and just doing it would be making sure that you're asymptomatic, because this definitely can place a fair amount of stress on your back, which may or may not be okay. And that's where, having, if you have a medical history or a current history, it might be more appropriate for you to, consult with a medical professional or movement specialist prior to make sure that A, you're either doing it right, or B, that it's safe for you. We're gonna, typically not start with any weight, but we'll just demonstrate with the weight. And in theory, the cat camel, you're trying to move quote unquote segment by segment. Same deal here. We're trying to lower a little bit at a time, obviously not looking that way, just not really looking downwards. And then over time, you should be able to get a little bit further, and you can actually get down to sometimes even past this at the bottom, which is why I usually like personally doing it with a platform. And then you just kind of reverse that motion and go up one by one. Now Laura's going to demonstrate it. She's a little bit more flexible than me, so we'll get her on a little bit of a higher platform, and we'll see that you can get a fair amount of motion below this depending on your body specifically.
Yeah, and so you're starting bringing your chin towards your chest, you're rounding, and you're working towards a smooth motion as you do this, going down. This is a little bit big, so I wouldn't necessarily use that. So you bring your chin towards your chest, and then you're reversing that motion, starting in the lower back, and then the mid back, and working your way up, and then all the way bringing the head up.
Typically, this works better with a smaller plate, just for ease of visibility. We'll use that. And then the other thing I'd say with respect to that is this, can be, especially like I said, if you're asymptomatic, a pretty decent stretch. So I'd say from a movement specialist standpoint, there's a lot of people that really like doing this one after they've done deadlifts and things like that, where you're working on stabilizing your core while lifting a heavy load. If you use a light load at the end, it can feel really good to retrain your body that it doesn't have to stay in that tight, rigid position as it's getting loaded. So it's something that a lot of physical therapists I've heard of that really like this one after they do like deadlifts and any hip hinge pattern or just any leg workout with barbells especially, or bent over rows even as well.
Because you're trying to keep a neutral spine with that, and then this reminds you that your body is able to move out of that position. And so a lot of times, like especially if you've had a history of a back injury or something like that, your body becomes a little bit more scared to move through that motion. So your brain kind of forgets how to allow your body to move into that. And that's where that motor control comes in. And that's why we're working that segmental motion, because our bodies were designed to move. And so sometimes it can be a protective response of our body, but just trying to re-educate our brain to communicate with our body that, hey, it's okay, is what's needed.
And then last thing that might be playing a role that we'll touch on today is called neurodynamics. Now, typically when people say nerve, the first thing they think of is actually typically like a bulging disc or herniated disc. And it's, very normal for nerves to have some type of tension and not have any symptoms whatsoever. It's also very possible for people to have bulging discs or degenerative discs and things like that, and it's not a nerve dynamic issue whatsoever. So don't go into putting this category into that train of thought. We're just talking about the generic ability for your nerves to floss in and out of different positions up and down along the chain in which they run. So this is, like I said, typically the last thing that it's thought of, but for a lot of people it can be the missing link. Again, is it the most common? It's really hard to kind of tease this out for yourself, and that's where seeking help or seeking the opinion and an evaluation by a trained healthcare provider is very appropriate. And it's, again, not necessarily that you specifically have symptoms going down, say, your leg, that you have a neurodynamic issue that's restricting your mobility. So you don't have to present with those symptoms that maybe a friend or a family member has had, that they said they have a nerve problem, for your nerves to potentially be impacting your ability to move.
Yeah, and there are some people that just generally are a little bit more, I guess, tightly wound, or have a little bit more like less nerve mobility. And if you test any of my nerves, I will always have nerve tension, no matter how much I do any of like the flossing exercise or things like that. That does not mean I have a problem or anything like that, but it can potentially, I might be more prone to it being a contributing factor to mobility or things like that. But those are essentially like the 4 things that I would definitely take a look at if you are having an issue bending forward. So again, the joint mobility, motor control, muscle length or muscle restriction, and then the neurodynamics. If you do want a full body mobility program with exercises to help loosen up the back, go ahead and check out my anti-sitting mobility program. It also includes some mobility exercises for other areas of the body too. But if you do want to loosen up the hips and low back a little bit more, I do have a follow-along video that does focus on lower body mobility. Or if you want to learn more about what goes into getting overhead motion, we do have a video here that I'll go ahead and link.